I'm Nehal Vidhan. I'm a clinical psychologist and professor and researcher at the Feinstein Institutes for Medical Research. And we are in the Human Neuropsychopharmacology Laboratory at Zucker Hillside Hospital and Northwell Health. So this is a laboratory that's been custom built to study the acute effects of intoxicating substances such as psilocybin or MDMA, cannabis, and alcohol. We're one of the few labs in the country that can administer some of these substances, which requires a lot of regulatory approval from the government, and maybe the only lab that is actually focused on psychiatric populations with this sort of work. Understanding the direct effect of substances, whether it's for therapeutic purposes, recreational purposes, or both, is critical to really understanding the positive impact that these substances might have, like for example in the case of psychedelics or medicinal cannabis, but we also want to understand the potentially negative effects of these substances, such as how they might affect driving behavior or increase the symptoms of a psychiatric disorder. We can administer substances to human participants, primarily alcohol, while changing the context of the room to match people's preferred drinking situations. And here is an actual bar that you would see in an establishment. We can actually emulate a bartender function where people can come to the bar and get their drinks while still preserving experimental standardization. Someone will get up after having their drinks, walk over here. Any study that we do that involves a substance of intoxication, we can have participants do a session in this simulator so we can understand and build a database of different types of drug effects. We're in the therapeutic psychedelics room. A doctor would come in and give them their dose of psychedelic. Patients will know what psychedelic is part of the study, but they won't necessarily know whether they're getting active or placebo, or in some cases, if we're testing multiple doses, what dose they're receiving on any given day. And what we expect to find is that people use these substances whether or not they have a psychiatric illness, many times for the same reasons. People use them to relax, to socialize, to get high. But there may be reasons beyond that that we will see in the patients with psychiatric disorders that we don't see in healthy people.